In the last 10 years, more than 50 gender clinics for children have opened, designed to provide medical interventions for children and teens who want to change their gender. And overall, the number of people seeking medical treatment to change is on the rise. The medical journal JAMA says the number of gender surgeries increased fourfold from 2000 to 2014. So how should the church relate to and care for these children and adults who identify with another sex? To answer this question, CBN's Heather Sells spoke with best-selling author Dr. Preston Sprinkle with the Center for Faith.
What are you hearing from pastors and church leaders? Are they beginning to see more people in their churches who are struggling with the transgender issue?
Yes, absolutely. I've been doing this full time for quite a while now, helping churches think through questions about sexuality and gender. And it was about a year ago when the number of emails and questions I would get, between like the same sex related questions versus the gender related questions. About a year ago, the gender related questions now are the primary questions I'm getting. We're seeing, as you mentioned, an explosion of especially female teenagers identifying as something other than their biological sex, whether it's transgender or non-binary, genderqueer, gender nonconforming, and there's a whole host of other identities. So yes, this is absolutely something that many pastors are wrestling with.
You've written about balancing love and truth when it comes to ministering to these people. How can believers remain faithful to Scripture and then also love a person well who's identifying as transgender?
Yeah, that's the sweet spot, I think, how to balance those two well. I think there's no real secret magic formula. I mean, read about Jesus and follow his lead. I think listening is a big thing for people like most of us who don't have any kind of a gender, that we're not wrestling with our gender identity. If, those of us who are at home in our bodies and we don't think much of it, we have a hard time understanding somebody who might not feel that way. So I think just being a really good listener, like genuinely listening so that you can understand what the person's trying to say. And listening doesn't mean you have to agree with them. It just means that you want to honor them in their humanity as they're honoring you by telling them your story.
I want to ask you about pronouns because from what I've read of your writings, you believe that when it comes to pronouns that there's some good reasons for using what a person asks for. So explain your thinking on that.
Yeah, that's a tough one. And I honestly can see good sides on both good reasons for both views. Well, one view would say that, if you use a person's pronoun that doesn't match their biological sex, then you're lying. And thou shalt not lie, and that's something I think we should consider. But pronouns and language as a whole is really flexible. Language changes over time, and today pronouns can be used to refer to one's biological sex, or in some cases, people use pronouns to refer to their gender identity, their internal sense of who they are. And you can disagree with that, but that's just how language works. Culture determines the meaning of language. So there is some flexibility there. And quite honestly, on a practical level, if you want to end a relationship with a trans person immediately, just refuse to use their pronouns and that relationship is gone. As Christians, I think we want to build relational bridges, not build relational walls. So I think there's a good case to use some of these pronouns.
All right. Well, Dr. Preston Sprinkle, a lot to think about. Thank you for your time.
Thank you for having me.